The man had been self-isolating at home for over 3 weeks after displaying mild symptoms, a cough and a runny nose. He called 111 3 days ago and called again just before midnight last night, saying he was short of breath. An ambulance was dispatched, and on arrival, paramedics found him to be suffering from cardiac arrest. Attempts to resuscitate him at home and A&E were unsuccessful. The government says symptoms suggest that this death may have been COVID-related. The results of a swab carried out this morning are awaited, and a post-mortem will be carried out. At this afternoon's press conference, the Chief Minister said it had not yet been decided whether any protocols would be changed as a result of this incident.
I cannot tell you now whether the circumstances around this death will change our procedures in any way, if it is confirmed that this death is COVID-related. We're of course learning every day how best to react, and there is no exact science on how best to address this virus and the issues that it creates for our community.
The symptoms were very, very mild and were not progressive, and he was given absolutely the right advice at the time by the 111 line. Please bear in mind that we always, as I've said before, we follow our best evidence and our Public Health England guidance on self-isolation or whether somebody needs to come to hospital, but also that these criteria are changing. And in fact, the list of symptoms that may be attributable to COVID changes almost on a daily basis, as I'm sure many people have experienced at home. And so there is a level of difficulty for all of us, not just from the medical side, from all of us even at home, as to exactly what may be a symptom.
The acting medical director said he was confident the 111 protocols had been carried out according to the guidelines set out by Public Health England. He said the man's symptoms had been mild and he was being given the right advice. He said the disease can progress rapidly, but added the ambulance had arrived at the man's home just 10 minutes after he called.
In terms of the question about whether the patient concerned had underlying health conditions, I would like to say that this in itself is medical confidential information and is also information that should really be considered by the coroner. And as such, I would rather not be specific about that. However, I will stand by the statement from this morning that we would consider this patient to be in a high-risk category in terms of the fact that he had a number of long-term ongoing medical conditions. But however, more clarity on that will be had when we have carried out a full investigation. The one thing we do know is that we're learning all the time with this virus, and we do know that the virus itself causes breathing difficulties. Everybody understands that now, and in some people, those changes can be very, very quick, and those quick changes can happen more often in those who have underlying health conditions that are unstable.
Dr. Rawal said the coroner's investigation will be conducted over the next couple of days and will examine the medical notes of the patient, including what happened during the night. The Chief Minister said he was in no doubt it was important to communicate this information to the public at the first available opportunity. He said it had been his decision to release the information and said he would not be sugarcoating information.
Right now, we are not attributing this death to COVID-19. We're saying it may be attributable to COVID-19, subject to a post-mortem and other tests. That is the reality, though, and that is why I decided that you needed to know as soon as we had that concern. You will get all necessary information from us, whether it's good news or bad news, but you will hear it from us, and we will work for you to trust us so that you know that you will hear all reliable information from us.
There are now 88 confirmed cases of COVID-19 in Gibraltar, with 42 of them active, and 363 results pending. 46 patients have fully recovered.